Hello, I'm Ciarán Lynch and welcome to OviCast, the Teagasc Sheep podcast. Each episode will bring you latest insights, advice and technical updates for the sheep industry. Now we're joined in this week's episode by Dr. James O'Shaughnessy from the Department of Agriculture's Central Veterinary Research Laboratory in Backweston to discuss Nematodirus disease in lambs. We start off with James discussing how it affects the lambs and the symptoms to watch out for. James also discusses the limitations of faecal egg counts for this condition. With the recent release of this year's Nematodirus forecast, James explains how to use this information and how prevailing weather conditions can affect this from year to year. We move on to discuss treatment options, with James offering some insight on the choice and timing of treatment. We also discuss the risk of concurrent infection with coccidiosis and how to approach this at farm level. Nematodirus can cause severe damage to young lambs. James advocates making use of the region veterinary laboratories where sudden losses occur to confirm the cause. We finish up with James highlighting the importance of correct dosing technique when treating for Nematodirus. We start off, however, with James describing the life cycle of Nematodirus and how it differs from other stomach worms.
Nematodirus is, I suppose, it's a severe parasitic disease of lambs in the age category of 6 to 12 weeks of age. Lambs become infected by ingesting large amounts of infective larvae that they get from grazing on contaminated pasture. A thing to say with Nematodirus is it's different to a lot of the other roundworms in that eggs deposited on pasture generally don't hatch until the following year. So this is typically a mass hatching event where soil temperatures would increase after a prolonged period of cold weather. And as a result, then ordinarily you'll see disease occurring in April, May and June.
And it's really hitting lambs at that peak season. As you indicated there, it's a carryover from previous years. Very few farms, James, out there, particularly in more intensive sheep farms, very few of them will have clean ground from year to year. So it's endemic in most sheep farms.
Yeah, I mean, it's so in an ideal world, you'd say move, lambs or sheep onto clean pasture. But as you say, that's just not, it's not a runner on the vast majority of farms, unless there was, say, for example, a change of enterprise. But it's not realistic yet.
James, what are the typical symptoms we're looking for with this condition?
I suppose when lambs get badly affected with it, you see, profuse diarrhea, you get dehydration. So basically lambs, and obviously weight loss as well. So if you get an outbreak, a situation where a lot of lambs are affected, you literally see lambs are standing around water trucks, purely due to the thirst that develops. You won't see any effect on the adult sheep, but certainly with lambs, diarrhea is your main clinical finding.
Jim, it's quite a severe condition, and I suppose unlike later in the year when we're talking more about some of the other stomach worms, fecal egg counts and that aren't really of any use for us here because it hits very early and hits quite severe.
Yeah, two things with the use of fecal egg counts for the Nematodirus. One is they're not much use, and two, they're not much use. So I suppose what I mean by that is a lot of the effect that the parasite has on the lamb is done in the stage before they start shedding eggs. So it's done by the larval stages mainly. So at that particular point, they aren't the larvae or the roundworm itself in the intestine lamb isn't mature enough. So you're not producing they aren't producing eggs at that stage. Now obviously you can get a mixed population of adult worms and the juvenile stages in the same lamb, and you will get egg counts. But even with that, the adult worm itself it doesn't produce a lot of eggs in comparison to, say, other roundworms. So fecal egg counts will generally be quite low, or even in cases you may not see any eggs in the fecal sample purely because the only stage present in the lamb is the pre-adult stage. So I would advise that it's farmers shouldn't be waiting around to get these elevated, very high egg counts, because you can get a lot of damage done long before that happens in a group of lambs.
And a lot of that damage is going to be persistent for the rest of the year afterwards. Like your damage in the gut that you're going to require. Like James, the symptoms obviously are one key thing. Given that life cycle, to an extent, you're able to predict when the peak hatch will occur and when the high risk periods are. And I know that's something that's just been released in the previous week. Could you just explain to us how has that worked out and what's its relevance?
Firstly, it's important that we recognize that the data we get for producing the forecast comes directly from Ciarán. So basically, Ciarán have a formula for predicting, I suppose, the peak egg hatch on pasture, which releases these infective larvae. So they look at the mean soil temperature for March at a depth of 10 centimeters, and then from using that formula, they'll calculate how many days, typically into April, but it can actually occur towards the end of March when there's this peak. We get this peak hatch of eggs releasing all these infective larvae onto pasture at the one time.
So as you indicated, like there will be, obviously there's going to be some variation even regionally in when that occurs, but that is when the peak challenge occurs. And of course it'll change from year to year depending on conditions. This year, given the fact we had a warmer March, that picture in the country seems to have occurred slightly earlier this year, James. Is that fair to say?
Well, yeah, I mean, I suppose like the data coming from Ciarán is based on, you know, the weather stations taken right through. I think there's 23 weather stations right throughout the country. So that's peak egg hatch at those particular locations, and they, you know, the data they'll produce, they'll give a date when expected peak hatch will occur. Now, obviously, you can get disease occurring before that. It's purely dependent on the burden of eggs that ultimately hatch out on pasture. So while the forecast is an excellent tool to use, I mean, people should always be on the lookout for signs of disease in lambs, or, you know, if they happen to have fecal samples sent to the lab. I know, given what I've said earlier about fecal egg counts, you know, if they have found
Nematodirus.
If they have found Nematodirus eggs in lambs that are exhibiting, you know, signs of diarrhea at this point in time, well, they should strongly consider treatment for Nematodirus. But certainly the forecast itself predicts the peak hatch when you expect to see the greatest exposure to Nematodirus by grazing lambs.
We'll go back to where we started with this. Like, a lot of that is hitting lambs at 5, 6, 7 week age period. Lambs at that stage are consuming grass. That's how they're picking up the infection. So that, for most of our mid-season flocks, lambing in March, that's kind of occurring roundabout now. If we talk about treatment, James, what are the treatment options for this?
There are several classes of wormers that you can use, but given what's known now about the level of resistance to different classes of wormers, the only class that we would recommend to use as a treatment are the white drenches. Now, the reasons for that are as follows. Firstly, to date, there are very, very few reports of resistance by Nematodirus to the white drenches. So the white drenches are extremely effective at treating Nematodirus. Secondly, at this part of I suppose the early in the grazing season, you don't want to expose, you know, your other maybe more effective drugs, like your ivermectin type products, or your white drenches, or your yellow drenches, to worms that, you know, they will be exposed again later in the grazing season. So you're basically using the drug that's it's really a narrow spectrum treatment. So you're treating with the drug that's really effective, and preserving the effectiveness of the other classes of drugs, when you don't really need to be treating for things like Teagasc or Sage or Trichostrongylis at this very moment in time. So the treatment is just directed really at Nematodirus.
And you're saving others for later. James, a lot of times when we look at this, we'll have some lambs born earlier, we've different groups, and we've tail end lambs joining them. There's there is no persistence for any of these products. So is there a case to go back in and treat some of them younger lambs at a later point? Is it possible they don't have the same level of burden or may need treatment at a later date within a group?
Yeah. Well, I suppose, you know, that, you know, when we talk about that 6 to 12 week age bracket, you know, if you start talking about, we'll say, triplet lambs, or, you know, lambs born to ewes with little or no milk that are forced to eat grass earlier than they normally would, you know, they for a start would be at a greater risk. Now, as you said there, with say, if you use your white drench, there's no persistence with the product. So given that, say, from the time a lamb picks up larvae off pasture, to the time it develops into an egg-laying adult. Like the life cycle is probably, it's about 14, 15 days plus before they start producing eggs. So basically, if you treat it and the product doesn't persist in the system, which we know it doesn't, you realistically would have to go back in with another treatment 2 weeks later. It's not like you're using, say, for example, products in cattle where a lot of them have a persistence. In the case of the Nematodirus, they don't. So yeah, you would have to go back in 2 weeks later on average with a second treatment, depending on the risk.
Very careful just to watch that window. James, I'm just thinking, like, at that age, I'm probably slightly gone by it, but another concern would be coccidiosis. Sometimes the two of them could occur together. Differentiate between the two of them at that age. Do you treat for the Nematodirus first and wait for it to clear up, or what's your recommendations if that's an issue on your farm?
Yeah, it's tricky. Without doubt, you can get both together. And the thing, I suppose, which makes it difficult is, on occasion, you assume it to be a Nematodirus, and you treat for it, and there's no response to treatment. In that case, it's highly likely that you are dealing with a case of coccidiosis, because, as we said before, the Nematodirus, we can kind of reasonably predict when you can expect to see peak hatch, so that the map will tell you. So, for example, on such a day at that weather station, you're going to have, in that area, you're going to have peak hatch of infective larvae. So approximately 2 weeks, 2.5 weeks later, you can expect to see disease in untreated lambs. So we're going in with a treatment, 2 weeks later, advising treatment 2 weeks later with benzimidazole or white drench. If you get a case where, where there's no response to treatment, you can strongly consider that coccidiosis is a likely cause in that case. So the two of them can occur together. Now, the thing to remember is with both of these, I've said earlier that with the Nematodirus, firstly, very few eggs can potentially be produced. Secondly, disease can occur before they start producing eggs. Now, coccidiosis is a protozoan. It's different, but the life cycle is thus that as well, you can also get quite severe damage done before the coccidia are starting to appear in a fecal sample. So you can get a fecal sample sent to the lab where there's little or no evidence of coccidiosis, but the lamb can be affected by coccidiosis. So the one thing I'd strongly recommend is, if you're sampling one lamb in a group, don't sample, if you've 20 lambs in a group, don't just sample the one lamb that's got a blood scour or that's got the diarrhea. Sample multiple lambs within the group, because by doing that, they won't all be at the exact life cycle stage. So you'll have some lambs shedding Nematodirus eggs, some won't be, but also with coccidia as well. You have some that will be producing lots of oocysts, some less so. But by sampling a number of animals in the group, it'll give you a far more accurate picture of exactly what's happening.
It can be tricky depending on the individual farm situation. James, we'll see some loss in lambs as well at the moment. I'm assuming some of that could be due to parasites. Aside from sending the samples, is there any other way of getting a diagnosis of what caused that?
It's. I would strongly recommend that, let's say, any lambs that die unexpectedly, that they're referred by your PVP or your private veterinary practitioner to your local regional veterinary laboratory, because it's a great way to follow up if there's unexplained mortalities occurring in the farm. Shouldn't always assume it's due to coccidiosis or Nematodirus. It could be due to something else. So it's important to always follow up in cases where you don't really understand, or the PVP is not sure what's going on. Just my advice would be to always submit a carcass for post-mortem.
And it could be a combination of things, but look at that services there, it should be used.
Yeah.
James, it's the first dose for many of the grazing season. The importance of good dose and practice, correct technique, it can't be underestimated to get the efficacy of these products and effectively treat the lambs.
Yeah, it's important, like, that firstly due care is given when the dose is being given, and that you're not run the risk of a dose and gun injury. And secondly, it's important that lambs are treated according to their live weight, because Ciarán, as you well know, with all the reports of worm resistance or treatment failures, whether it's cattle or sheep or whatever, a lot of it comes back to people underdosing cattle or sheep. So they're not given, enough of the product for the live weighted animals. So it's important that there's good, accurate live weight. People know exactly what live weight the lamb is, and then the product's given accordingly, with due care, because there's also reports too of in lambs where you can't, small lambs, you get with dosing gun injuries most certainly can occur.
Definitely something you want to avoid. James, it was great having you on today. Really appreciate you giving up your time and giving us that update. Thanks very much.
You're very welcome, Ciarán.
We're going to have to leave it there for this episode. Again, it's one of those conditions that need very prompt and timely treatment. I have included a link to this year's 2022 Nematodirus forecast in the description of this podcast. It's well worth having a look at. Again, it highlights the regional differences as well as some very useful advice on the condition. That's it for me for this episode. Again, for any updates from our sheep program, keep an eye on our Twitter page at Teagasc Sheep. I'm Ciarán Lynch. Thanks for listening. Don't forget to subscribe and get notified of any new episodes.